So this is a fabulous case. Right, okay. So today's a day of 4 Cubans. It's a special day. Actually, this is Lorraine Corsell. I'm indebted to her because she helped me with this presentation. She's with Medical Arts, in our department. But she's standing next to, who I'll get to in a moment. A second Cuban I'd like to mention is Ada Basri. Are you here, Ada? Yes, there she is. Red is over there, who's come from New Jersey. I'd like to also say hi. I think is Lucy here? Lucy Cho? Dr. Cho? Yeah, Dr. Cho. When I came as a fellow to Memorial Sloan Kettering, we didn't have a full-time neuropathologist, and Dr. Cho volunteered her time to come and help out. A day a week. When she wasn't around, we carried our cases to Cornell if we had to show them to Carol Petito. But so now things have changed a little bit. We now have 2, as you just heard. But anyway, so this man here is Manuel Cruz, Bishop Cruz. He's not here with us, but he is an honorary member of this group. And in fact, I instated him as an honorary member of this group some years ago when he was a young priest in Cuba. The third Cuban. He was ministering to medical students. He became interested in what they did, very interested in anatomy, very interested in histology, bought a microscope, and is an amateur microscopist with a subspecialty interest in neuropathology. He can't be here, but he wants you to know that he extends his blessings on the group. I have made my confessions to him, and he assures me that I could be forgiven for my human failings. There is the small matter of my converting to Roman Catholicism, but So the case that I'm showing you is an immunocompromised patient, obviously a 54-year-old woman with myeloma. You can read this. She developed a cough. She had fever of unknown origin. The workup was not revealing, including the cultures that you see here. And over a week-long period, she became headachy, increasingly confused and lethargic, and this is her MRI. And you can see, in fact, there are 2 lesions, obviously the much more dominant one here in her right frontal lobe, contrast enhancing with a tremendous amount of edema, a second one here in the contralateral frontal lobe. And so the clinicians, thought about many things. Could this be involvement by myeloma? Would be most unlikely. Obviously, they were thinking about infection because this is an immunocompromised patient, and they were thinking about demyelination. And just this is one of the images that I sent you. I don't think you require a hell of a lot of training to realize that there's a lot of histiocytes here shown, CD163. And this is a myelin basic protein that was really done only because a young resident in neurology wanted to be certain that this was not demyelinating disease and didn't want to take my word for it. You know how they are. So I did this, and that's that. But if you looked at the images that I sent you, you realized that histiocytic infiltration is not really the main story here. Rather, there is acute purulent inflammation here with the formation of microabscesses. And if you don't think about an infection when you see this, I think your thought processes are disordered. So a lot was done to try to prove or rule out an infection here. Preoperatively, there was this, bronchoalveolar lavage, urinary Legionella antigen, brain biopsy. What we did on the brain biopsy, Gram, GMS, you can read this for yourself. Some immunohistochemistry, we looked for EBV, and also a brain tissue culture was done, and the cultures were entirely negative. Now, our infectious disease group here, I imagine much the same is true in institutions, in your institutions, have become increasingly interested in the use of PCR-based methods of diagnosis on biopsies in situations in which we are unable, or cultures or serology are unable to establish a definitive diagnosis. And that was done in this case, and it came back with an interesting result. The laboratory where this was done actually did this in triplicate since the result was so unusual, and found PCR-based evidence for Legionella jamestowniensis within this biopsy. Now, this was first isolated here in New York, from Jamestown, New York in 1985. And at the time that this report came back, the number of cases of human infection with this agent that it reported were precisely none. And so the ID people contacted me and said, well, Dr. Rosenblum, we're getting this result, but we're not sure that we can trust this. Did you do any of the specialized stains that are required to demonstrate Legionella in tissue? You might not be able to see them with gram stain, which is true. And you all know from looking at silver stains in brain tissue, I'd frankly rather be waterboarded than have to interpret one. But I did it, and sure enough, there they are. And there are just innumerable small rods in here, which would suggest at least that this is not really a fluke. So Legionella Jamestowniensis infection. Now, this is the Bellevue Stratford Hotel in Philadelphia. It was built at the turn of the 20th century, and at the time that it was built, this was regarded as one of the two most elegant hotels in the United States, if not the world. In fact, the Waldorf Astoria was the only hotel that was believed to rival it for its elegance, the amenities that were provided. And it was here in the summer of 1976 that a couple of thousand American Legionnaires gathered to celebrate the bicentennial of this country. At that convention, over 200 of these unfortunate individuals became severely ill, and 34 died. And as you can see, and some of you may be able to remember, I certainly remember when this occurred, this was a completely mysterious turn of events. Tracing the Philly killer, mystery of the killer fever. And a lot of effort, and this caused panic, and concerted effort began to try to determine what had happened to these people. And even Bob Dylan got into the act, writing this song, Legionnaire's Disease, a future Nobel laureate. This is not, in my view, one of his best efforts. but it does reflect the complete sense of mystery. People were saying the anti-war movement was on. People were thinking, well, had these people been poisoned? Had they been who knows what? You can see some say it was radiation, some say acid on the microphone, some say a combination that turned their hearts to stone. Whatever it was, it drove them to their knees. Oh, Legionnaire's disease. I wish I had $1 for everyone that died that year, got them hot by the collar. This is a reference to the severe spiking fevers of the disease. Plenty an old maid shed a tear. Now, it was in my heart, sure put on a squeeze. Oh, that Legionnaire's disease. Whatever it was, it came out of the trees. Oh, that Legionnaire's disease, that Legionnaire's disease. Like I said, I don't think it's one of his best, but they got sick in the ballroom. If you go to the hotel now, and after a period of time in which the hotel was completely closed down after this, as you can imagine, it eventually did reopen under new management. This is what the ballroom looks like now. A rather lovely place. And if you walk around and you look up at the ventilation system, this is what you generally see. If you ask anyone who works in the hotel about these events, they don't really know that this happened. So here you see a nice modern ventilation system that is very nicely filtered, but there are still some places in the hotel where you can see some of the older ventilation system, like this. And this is what it used to look like. This is what it looked like in the ballroom in 1976 when our Legionnaires congregated there, and there really is nothing by way of a filtration system here. I mention this because, of course, the agent of this, what came to be known as Legionnaire's disease, Legionella Pneumophila, got to these people via droplet inhalation. It spread through the ventilation system of the hotel into that room. And here is the culprit, Legionella Pneumophila. Now, a few words about the Legionella. They are aerobic. This is important, they're really poorly visualized or not seen in standard gram stains. There's a specialized, a modified gram stain that's hardly ever used in which you can show them. They are demonstrated nicely in Orthostari, Dieterle, and Steiner preparations. They are aquatic, and they can be found in almost anything that is fluid. As you can see here, particularly there have been lots of outbreaks, including recent ones in New York City that have been related to water cooling towers, etc. But you can find them in vegetable misters, humidifiers, Watch out about giving birth in water, you know. And they spread via droplet. That's true. They spread via droplet inhalation, and our case was negative on culture, and they generally fail to grow on standard media. You need a specialized agar to grow them. And there's a bunch of tests, you know, for diagnosing them. In fact, I mentioned to you that the Legionella, the urinary antigen was negative in this case. It's an excellent test, but the problem is it only picks up Legionella Pneumophila serotype 1, which is the most common culprit of severe disease. Now, the major clinical syndromes, Legionnaire's disease, which typically is characterized by high fever and severe pneumonia, and this is one of the most common causes of both severe community-acquired and hospital-acquired pneumonia. And then Pontiac fever, a non-pneumonic form of the disease. It's much milder, and patients generally recover. As I told you, more than 90% of cases are caused by this one. This is how many cases occur every year in this country that require hospitalization. There still is significant mortality associated with this. And you see the risk factors here: age over 40 years, smoking, alcoholism, chronic lung disease, and immune compromise. Now, I shared this case with one of our fellows, who's not, I don't think she's here today, Sheila, who's not here today with us, Sheila Segura, and she emailed me this study about risk factors in Legionella disease, and she had underlined this: working more than 40 hours a week and spending nights away from home before illness. I thought that I might have been registering a faint complaint here. And Dr. Segura, you know, a charming, a very good pathologist, a Dominican, a Caribbean. We know that these people do not like to take care of themselves, you know? Right, yeah. They want everything done for them, you know? So I had to turn to her and say that in my long experience here at Memorial, I could not remember a single fellow who had been felled by Legionellosis in any form. So that's that, and I won't say anything more about that. All right, now, neurologic manifestations are actually seen in up to half of patients who have Legionnaire's disease, and it can produce a whole slew of abnormalities, but autopsy studies have almost uniformly failed to demonstrate the organism actually in the tissue. And so it's felt that most of these complications of Legionnaire's disease are mediated by neurotoxins, or they might actually be immune-mediated. There are very, very few confirmed infections. In fact, at the time that we saw this case, there had been only these here. You'll notice that all of these are immunocompromised hosts. A 5-month-old boy with SCID, a 57-year-old woman with a history of systemic lupus erythematosus. Only one of these patients really was previously healthy. You'll also notice that in a couple of these cases, it was an unconventional agent of Legionella, not Pneumophila, that was responsible. So immunocompromised patients may be particularly at risk for the non-Pneumophila Legionelloses. This was one of 3 cases of extrapulmonary Legionellosis that we have seen here at MSKCC. Again, although this figures given our patient population, these are immunocompromised patients. 1 a 3-year-old boy, as you can see here, who had actually Legionella pneumophila identified in the skin biopsy material. A 3-year-old girl, also stem cell transplant here, and with liver lesions and lung mass, and this one, another Pneumophila infection, serotype 1, the most virulent serotype in lung and liver biopsy material. Since we saw this, actually, there have been a couple of reports of Legionella isolated from human beings. At the time that we saw this, it had never been reported. This was a patient with chronic obstructive lung disease. In fact, this is a patient who had allergic bronchopulmonary aspergillosis. Whether the Legionella Jamestownensis isolated from this patient, which was the first sequence, had anything to do with this chronic lung disease is debatable. This patient, who was immunosuppressed, developed a fatal pneumonia that was clearly attributable to Legionella Jamestownensis. Jamestown. So this is Lake Erie here, okay? And Jamestown is right there. And Jamestown derives its name from this fellow, James Prendergast. Now, Prendergast people came from the British Isles, and they were early settlers in New York State. And James Prendergast explored the region of New York State around near Lake Erie, and over a couple of days in 1808, he and a hired man of his put up a log cabin, which was the first structure in what was to become Jamestown. There's some things you should know about Jamestown. It has some famous sons and daughters. This is one of the famous ones, but a very controversial one. Of course, this is Roger Goodell, who is the commissioner of the National Football League, and here he is with Tom Terrific, Tom Brady, the New England Patriots quarterback and one of the most celebrated quarterbacks ever. Now, you wouldn't know it to look at this picture, but these two became embroiled in a major sports scandal and really came to hate each other's guts. And I'm referring, of course, to Deflate Gate. The Deflate Gate in 2014, for those of you who are not sports fans, you should know about this. In 2014, evidence emerged that on Tom Brady's orders, footballs that he had used in a conference championship game had been deflated below the regulation pressure so that he could grip them better, throw them more accurately, and maybe not fumble them if he was hit. He was immediately suspended for 4 games without pay, and as was his right, he appealed the suspension, said he was innocent. There were options to bring in an independent investigator here, but what Commissioner Goodell decided to do was to have an internal inquiry, and after this inquiry, he announced, and he seemed very happy to do so, that the man was unquestionably a cheat, and that the 4-game ban without pay was going to be upheld. This actually went to federal court, and ultimately, Brady decided things were not going Tom Brady's way, and he decided that the jig was up. He was going to have to serve the 4-game suspension. And so, last season, he sat out the first 4 games of 2016. And when he came back, he really came back with a vengeance. And he led the Patriots to the Super Bowl. And for those of you who saw it, it was one of the most dramatic Super Bowls that was ever played. His team was down in the third quarter, 28-3, to the league's most powerful offense. This is the Atlanta Falcons. Brady, remarkable performance. He brought his team back, forced the game into overtime, and the Patriots won in overtime. And in doing this, he threw for Super Bowl records of passes completed, yards gained in the air. He won his fifth Super Bowl, most of any NFL quarterback ever. He took his 4th MVP trophy, the most valuable player in the Super Bowl. That is the most of any football player ever. And of course, the beauty part was the deflating effect that this had on Mr. Goodell's balls. And this man is still, to this day, vilified throughout New England. People continue to call for his resignation. He remains the NFL commissioner. He's a little controversial. This person is much less controversial, okay? On August 6, 1911, this wonderful person, Lucille Desiree Ball, was born in Jamestown. And of course, this is Lucy with her actual husband, not just the man who played Ricky Ricardo, her television husband, but her real husband, the 4th Cuban of the day, Desi, actually Desiderio Arnaz. And they really were quite the couple. In addition to being a wonderful comedian, she fell prey to investigation in the McCarthy era, and she actually did deny what was her clear-cut involvement with the Communist Party, but she did not name any names, and she did something rather brave. She became one of the few Americans who went on radio to read the Bill of Rights to other Americans and to explain to other Americans that they did have the right to voice unpopular political views. Her husband, in the Latin American Hall of Fame, it is not known that he was revered by generations of Latin musicians for what he did to facilitate the careers of young and upcoming musicians. At any rate, so she is another Jamestowner. Of course, I'm happier to talk about her than poor Mr. Goodell. And there's a reason to go to Jamestown, one reason, and that is to visit the National Comedy Center, which is located in Jamestown, New York, in honor of Lucille Ball. And this was it on the day of the groundbreaking ceremony. with the artist's conception of what it would look like. It's now open, it's functional. And if you go there, there is a National Museum of Comedy there, and it's named for Lucille Ball. There's another reason to go to Jamestown. These are the official wine regions of New York State. And notice that one of them is right here on the shores of Lake Erie. This is right where Jamestown is. And Jamestown, actually, many people go to Jamestown. They make it a center, and they take tours of the wine country. And this is exactly what our patient and her husband did 12 days before she developed the symptoms that ultimately led to discovery of her brain mass. She and her husband overnighted in Jamestown, and they took a tour through several vineyards, wet soil and all. And so the best part of this is I'm not going to show you a malignant neoplasm. This isn't a neoplasm at all. You know, this is something that's benign, infectious, and fixable. Here she is. The infections by Legionella, if they're identified, are treatable. Some patients do require some rather exotic second-generation, third-generation regimens, but here she is on trimethoprim and sulfamethoxazole before and after 3 months of therapy. Notice this lesion is completely resolved. This lesion, she was afebrile now, asymptomatic. This is substantially contracted, and she remains well to this day. So I've shown you a case of Legionella Jamestowniensis infection, complicating immunosuppression and oinophilia, and I do invite you to pick your poison. You know I'm a Scotch drinker myself. We'll see you at the Water Club for cocktails and dinner, and thank you all for your attention.